clinics.
Are the women in Western Jamaica having babies?
Oh
Do we have a
boy.
lot of women having babies?
I mean, I mean, that is our business, but I'm telling you that there are times when I'm saying, boy, we should.
Hi, you're watching West Side JA with Janet Silvera. My guest today is an obstetric gynecologist by the name of Dr. Wayne Harvey. Now, this is a very shy doctor, very charming, but also one of the most respected in the city of Montego Bay, having delivered thousands of babies, having operated on many of our women. Dr. Harvey, welcome to Westside JA.
Well, thanks for having me.
It is a pleasure.
Mm-hmm.
I asked you earlier today, how many children you have delivered, and you said, answer me again.
Thousands, actually.
You can't count. You have stopped counting.
I've stopped counting. I mean, when I was trying to get into the postgrad program at university in 1997, at that time I'd gone about 300 cesarean sections at that time. That was from 1997.
Oh my God. So you have been a doctor for how many years?
From 93. Class of 1993.
You have to count that from me, doctor.
Oh.
Is that 30 years?
Yeah, well, yes,
That's
actually.
A long time.
Mm-hmm.
But where are you from originally? And tell me about growing up in that area or that side of Jamaica before you became a Montegonian.
Well, originally from St. Ann, born in Brownstown. Grew up in Discovery Bay. Mm-hmm. And that's where all my friends were. But my mother said, boy, she wanted me to do medicine. And she didn't think those high schools in St. Ann were good enough for me to get into medicine.
Wow.
So she moved to Kingston just to allow me to get into one of the high schools there.
So you ended up going to?
So I went to Calabar for the first 5 years, and then Woolmer's Boys, sixth form. Mm-hmm. And from there, I got straight into medicine.
Straight into medicine?
Yeah.
High school?
Yeah, I went in.
So you were a bright one then?
I wouldn't say that, just read a lot.
And then you moved to Montego Bay after leaving med school, or you went to work in hospitals?
No, what happened, actually, you're supposed to, back in that day, you were supposed to apply for the region hospital that you want to do internship at. And I forgot. So they actually placed me in Cornwall in Montego Bay. So I ended up here purely by chance, and I haven't left since.
Well, this is supposed to be a very serious interview, but I mean, minutes into the interview, and you have me laughing like crazy.
That's good.
You forgot to apply for where you needed to go.
Yep.
So you ended up at the famous Cornwall Regional Hospital.
Yes.
And you are now a consultant in the
obstetrics and
gynecology department.
Yes.
Because, I mean, I've been trying to get an interview with you, and every single time I'm told that you're too busy, you're at the hospital every single morning, and that you're not available. Talk to me about that. What is it that you do at Cornwall Regional Hospital?
Well, actually, the department has 3 firms, as in divided up into 3 sections. Mm-hmm. You have a consultant in charge of each firm. And under that consultant, you'll have resident and senior resident, residents, interns. So I'm in charge of one of the firms. So at any one point, I'll have a senior resident, residents, junior residents, and interns. And basically, the patient load is split into 3. So I have a third of the patient load up at Cornwall. So we have our own clinics.
Are the women in Western Jamaica having babies?
Oh
Do
boy.
we have a lot of women having babies?
I mean, that is our business, but I'm telling you that there are times when I'm saying, boy, we should try and put some contraceptives in the drinking water for Montego Bay, because they won't stop coming. It's our business, we love it, but sometimes you're tired and yeah.
So we are having a lot of babies.
Oh, we are having a lot of babies.
I understand also that one of your specializations, if not your specialization, is doing myomectomy, and you consider this to be a very safe method, and that is why you do so many myomectomies. And tell me what a myomectomy is. I haven't done one myself, I already know, but if there's someone watching, I want to find out, why would a woman need to do a myomectomy? What is a myomectomy?
Okay.
Etc.
All right. Myomectomy basically is removal of fibroids, which is just some swellings in the womb or uterus of the female. Very common, especially in black women. So at any one time, 60-70% of black women will have these fibroids or swellings in the womb. So basically what these swellings can do is cause heavy periods, painful periods, or affect fertility, where babies grow, implant and grow. So, and then of course, just the aesthetics of it, some get so big that the female actually looks pregnant. So basically what you want to do is either take out the uterus with all of these fibroids if they've had all their kids already, or take out the fibroids alone, leave the uterus behind for the women who wish to have kids.
But there is there's a myomectomy, and then there's hysterectomy. So the hysterectomy is when you take out the entire womb. Okay.
So the myomectomy, though, why it's a bit more risky than a hysterectomy is that you're cutting into the womb that has its blood supply to take out these fibroids or growths and close back the cavities where you take them from with blood still flowing to the womb. So it's a bloody procedure as opposed to a hysterectomy where you just clamp the blood supply and take out the womb, relatively bloodless. So that is why they will say myomectomies are a bit risky. Also, I mean, I take out fibroids as well during cesarean sections. No, this for many, many years has been deemed very dangerous and not to be done. In fact, if you read a lot of journals, even now, they will tell you, do not take out fibroids during a C-section because you're writing the death certificate for a woman.
But is that true though?
Well, Dr. David Brown is the first one. He taught me a lot of stuff. He was the first one who ventured to take out a fibroid that was close to where he was cutting during a C-section. And he realized that the cavity was clean, no bleeding and stuff. So we realized that when you take out a baby out of the womb, it contracts right down in front of you, locking down the blood vessels. So we say, if you take out the fibroids, it should do the same thing. So we did, found that the blood loss was very minimal, so we started to do it. I mean, that I wrote my long case when I was doing my postgrad degree. I wrote my long case on cesarean myomectomies.
So are there a lot of women in Jamaica that have gone through C-section and myomectomy at the same time?
Yes, quite a bit.
And they are alive?
They are alive and well.
Have you sent your research elsewhere so other doctors in the rest of the world can see what we're doing here in Jamaica?
What happened, when we do these researches, when we're doing our postgrad,
Yes.
our senior lecturers there, they actually take on these studies and present them. So my study was taken on by Prof. Fletcher up at
Professor
university.
Fletcher,
Right, up at university. So he has done some publications on it. He's done quite a few, some of these from Cornwall.
Fantastic. You know, those type of things are happening, and I'm sure many people in the country, many people outside of the country aren't aware of
Yes.
how far and how advanced we are medically speaking.
Yes, we are. And I mean, it's a technical thing that requires speed. That's the thing. So you have to be very quick when you're doing a cesarean myomectomy or just a plain myomectomy. So a lot of surgeons will shy away from very big fibroids, and they want to have all the necessary backup and stuff. Because I mean, while I was up at University Hospital, they allowed cesarean myomectomies to be done as long as I was there. But when I left, they stopped them.
Are you serious?
Yes.
Oh my God.
So no, I mean, I don't think they're doing many up there.
And here we are thinking that that there are other more advanced hospitals in Jamaica than Cornwall. When you have a man like you and other residents that pass through and are able to do these things.
Yes, yes.
But when you say it has to be done fast,
Mm-hmm.
what's fast for you?
Well,
You have been watching West Side JA. We'll be right back.
All memorable moments include delicious food. Good food can transform the ordinary into extraordinary. We welcome more good times together, more memories we won't forget.
Rainforests always I make delicious moments.
But when you say it has to be done fast,
mm-hmm.
what's fast for you?
Well, a cesarean section normally takes about, on average, 30 to 45 minutes.
Right.
During which time, you know, you'll have blood loss. But Dr. Brown, he was very quick. So my intention, following Dr. Brown, was to be as quick. So, of course, with being very careful. So we cut the time. So right now, I mean, these times shouldn't be said on air, but I've cut the time down. My fastest time from skin to skin is 7 minutes.
7 minutes? You mean doing a C-section?
From the incision, to the last stitch.
To the last stitch?
Yes. So,
oh my
yes,
God.
but I mean, I was warned by Prof. Fletcher when I was going up to university to do my postgrad degree. He says, Doc, I hear at that time I did a 9-minute section. So he says, Doc, I hear that you down Cornwall doing 9-minute sections, you know. You're not coming up here to do them things, you know, you're going to take your time.
Let me ask you a question, Doc. And I really want to talk about Rejuvenant
Okay.
that you have introduced. But I'm so enthralled. I'm so interested in this speed and this myomectomy. You know, just one, you have to have very steady hands as well.
Yes.
To be able to do this, right?
Yes. And I mean, it's just that it's something you can't be afraid. I mean, you see blood and blood loss, you still have to be quite relaxed, right? You can't let it phase you, because with all that bleeding and stuff, you're going to be tempted, oh boy, I'm going to take out her uterus to stop all this bleeding. And then you think back, it's a young female begging you before surgery, please doc, save my womb, I don't have any kids. So you know you have to go through quickly, because the longer you're there, the more she'll bleed and the more her blood loss will be, and then the greater the risk of her losing the uterus. That's why speed is essential.
It's very important. I want you to tell anyone who is watching what it is that a woman needs to do. We know that black women are prone to having fibroids, but is there anything that one can do to prevent having fibroids? Is there anything?
Boy, you have a lot of myths and stuff going around where, you know, there was this thing about eating chicken because they were hormone grown, and a lot of things going around there. But from what I've seen, from what I've noticed, it's basically genetic and just part of being black. You will see it in white and other races, you know, but it's so predominant here. I mean, my wife eats chicken all the time and she doesn't have fibroids, and I've seen it all over. And you have young females in their 20s who claim they are vegetarian and stuff, and they have fibroids, riddled with fibroids. So, I mean, it's just that you just have to check and make sure that, you know, you do your checkups time to time, because once you have them, then you're aware and you know you try and get rid of them at specific points in time. And that's the other thing too. A female here, she has a fibroid, say a 1 or 2 centimeter fibroid, and say, doc, you need to do something about it. But basically, the drugs that are used to shrink fibroids is just temporary. What it does is shuts down your ovaries, the eggs, and that shrinks the fibroids to a degree. But this medication you can't give for more than about 6 months. And after they stop that medication, the fibroids actually get back bigger than they were before.
So you're saying then that the only option is surgery? Once you have fibroids, is that the case?
There are a lot of things going around. People talking about herbal stuff and, you know, natural foods and stuff. But I have rarely seen a woman come to me with fibroids. I've documented it over the years. You see a steady growth. The only time it actually stops growing and sometimes go back, right, when she goes into menopause, right?
That is what many doctors have told me as well. I did a myomectomy, and I ended up having to do an hysterectomy.
Okay.
And it sent me into early menopause. But there goes the fibroids. I'm happy that I was able to get rid of them. They've gotten frustrating, to be honest with you. They had really gotten to me.
Yeah, it's...
What's the youngest age of a woman? That youngest woman that you have ever seen with fibroids?
I've seen as low as 24, 25 years old. Yeah.
So when you're not doing surgeries, I understand that you have introduced Rejuvenant, which is for women like me who are constantly busy, gets tired because I'm too busy and running up and down all over the place, and that you're able to rejuvenate me if I come and sit in your office. But I remember it wasn't made for me in the beginning. It was made for pregnant
initially, well, it's a brainstorm of me and Richard, who, you know, the gym fitness instructor. And Richard Dina, right. So what happened is that he was always telling me that he wants to make some cocktails to give his clients, because when they exercise and they're tired and stuff, he wants to really make something that allows them to work out well, not get so fatigued, and recover quickly from their workouts. So I said to him that, well, we have a lot of pregnant ladies in early pregnancy who they are fatigued and stuff because of excess vomiting from early pregnancy. And a lot of times it's dehydration that causes them to feel this way. And the more dehydrated they are, actually the more they vomit. And it's a vicious cycle. So introducing fluids directly into their veins, into their circulation, is a way of rehydrating them. I mean, it's nothing new because you've seen people with blood loss or dehydrated getting IV infusions in hospital. So the thing is, when you are exercising, or even the pregnant ladies who are vomiting, we say to them, drink coconut water, drink Gatorade, drink Lucozade. But because of the constant nausea, anything hits the stomach coming back up.
Right.
But if you give them through a drip, then it's not passing through the stomach and they are getting hydrated. So they immediately start to feel better, right? So you just combine the hydration fluids with vitamins and essential nutrients, and you find that it saves hospitalization. Because a lot of times, and I notice it, they come into casualty, they're looking very ill, early pregnancy, very ill, very dehydrated. And you would say, hey, this one needs to be on the ward. But you run in 3-4 bags of IV fluid, and even without anything in it, and you'll be surprised, after 6 hours, these patients walk out of there, right? So
you're saying then that Rejuvenant is something that you have put your own cocktail into?
Well, we have worked on our own little cocktail. I mean, as I said, when we rehydrate patients vomiting in early pregnancy, it's basically giving them stuff to prevent vomiting and giving them nutrients, the various vitamins, and because they will be lacking these with all the vomiting and stuff in early pregnancy. Basically, we're just replacing it, and that helps.
So you're replacing it with pregnant women, and you are also replacing it with people who are going to the gym.
Right, because it's
so if I get tired, I can come to your office now and be rejuvenated with Rejuvenant.
Oh yes.
I don't have to be pregnant.
No, you don't have to be pregnant.
Because I don't want to be pregnant again, you know.
Yeah.
In fact, I don't think like I can be pregnant.
I don't think so. I don't think so. Yeah, but that's a general idea. As I say, it came from rehydrating and getting these pregnant women who are so ill back on their feet in a matter of hours. So, I mean, we just extrapolated and say, hey, these athletes or anybody who feeling down, tired, a lot of times it's just hydration. In fact, my wife has proven it to me time and time again. She feels lousy, I feel lousy. We drink and drink and drink, and in a couple hours we feel better. But with that, it still has to pass through the stomach, intestines, get absorbed. You'll drink and you pass out back quite a bit of it without absorbing it. Getting the IV hydration goes straight into the blood circulation, straight bypassing all of that. So you feel better faster.
How often can I be rejuvenated?
Well, it is something that you can actually, I mean, if you don't have the time to say, be going around drinking, you know, you go in once a week and you get yourself hydrated. And even though during the course of time in between, you might say, hey, I'm going to get dehydrated again. But it's good to get your body fluid levels up to par and just encourage drinking right in between. So it's a quick way of getting back your energy without having to be guzzling a whole lot of fluids. You see what I'm saying?
I see. But how long does it take though for the procedure to be done? And what exactly is it? What is it you do? You inject something?
Right.
You
You
put
just
it's an infusion,
yeah, it's an infusion. It's a drip basically that you set up in the vein. Right. And
so would you be able to show me that on camera? I would like to see what that looks like, Doc, so that all the people who are watching will get an idea of what this Rejuvenant is, because I'm very interested in it. In fact, I hear that the possibility exists that you might have Rejuvenant at Mobile City Run.
Oh, yes.
For the athletes who are running in that 10K,
Yes.
5K run and walk. So I'm very curious about it.
Yes, we're thinking of setting up a tent and showcasing our product there.
Fantastic.
Right.
So you're not going to rejuvenate the athletes?
Oh, yes.
Oh,
I mean, yes, for those who are interested, I mean, you know, because as I said, it's when you're really tired, sometimes you're actually so tired you can't even drink.
It's true. Doc, I've been there, done that, so I know exactly what you're saying. You have been watching West Side JA. We'll be right back.
All memorable moments include delicious food. Good food can transform the ordinary into extraordinary. We welcome more good times together, more memories we won't forget.
Rainforest always, I make delicious moments.
So you're watching West Side JA with Janet Silvera. My guest today is Dr. Wayne Harvey, an obstetric gynecologist who has delivered several babies in this town, has done a number of myomectomies, hysterectomies, and is one of the most respected consultants at the Cornwall Regional Hospital. What he has done though, he has introduced Rejuvenant to rejuvenate those of us who are tired, those of us who don't have enough fluid in our bodies and need to be rejuvenated.
So this is where we do our setup. So we set up most of the drips in the left hand because
Why?
the majority of people worldwide are right-handed.
Ah.
So unfortunately, it's a bit biased to the right-hander. So which is why. And if you're going to operating theaters and stuff, you'll find that everything is set up mostly for the right-hander. They'll tell you set up drips in the left hand because of where they put the anesthetic machines and stuff. Okay.
But in this case, I'm sure it will be in my right hand.
Left hand, because see the stuff is on the wall.
Okay, all right, fine.
Right. Okay, so it's a simple matter of trying to get a vein up. So be a little tight. And you just pump the hand, open and close, open and close. All right.
It's what?
It can't just stay like that. You see what I say? No, I'm not gonna stick it.
All right.
So
Okay, you have to put it over.
if we're doing the real thing, it goes in, and I can let it go while you hold the fist and get my tape and stuff.
All right.
So first thing,
Yeah.
have to clean the area after we get our veins up. Right. And then we get our. So we use a small one because this is just for rejuvenation. If somebody is in an accident or during surgery and they need blood and whole heap of fluids or blood very quickly, then we use a bigger needle.
Okay.
But we use small needles. We get the vein.
I don't know if you want you droop me.
No, not waste. And I will stick you. So, and I will stick you.
All right,
man.
I get the juice. Thank you, Doc.
Yes.
I appreciate it.
Oh, you're most welcome.
You have been watching West Side JA with Janet Silvera. It has been our pleasure. I hope you have enjoyed watching us. Thank you.